video today, I'm going to be explaining what health and care worker visa means, who are actually eligible to apply for this visa, the requirement, the cost, and everything that you need to know about this. I'm going to be sharing my screen so that you understand everything that you need to know about this visa. Hi, Linda Eze here. Welcome back to my channel. If you're new to this channel, well, my name is Linda Eze. I'm a registered nurse and I work in the UK. In this video today, I'm sharing my screen to just talk about health and care worker visa, the requirements you can do to actually apply for a job, and above all, the tips to make the right decision in the process. Okay, if you like the content of this video, please share with someone that needs the information. Like, subscribe so that you support this channel and this content will be seen by many more people. Okay, so let's dive into.
Let's begin. So the first thing you need to do, just go online and Google health and care worker visa. I've already typed it here, health and care worker visa UK. So when you search this, the official website is going to come out and it's going to look like this, the health and care worker visa UK. Just click on this one and it's going to show you everything you need to know about this visa. So I decided to show everything so that it will not be like just one of so many other videos that you keep seeing online. At the end of the day, you will not know exactly what to do. So you're going to be looking at, okay, what is this visa actually? So this visa, try and also go through this and know how you can actually use this or share with someone that actually needs it, okay? So a health and care worker visa allows medical professionals to come or stay in the UK to do an eligible job with the NHS, an NHS supplier, or in adult social care. Just know that, okay? So, and then so many other details about it, but we just focus on what we actually need to know about this, okay? So eligibility, the type of job that is qualified for this health and care worker visa is you must be a qualified doctor, nurse, health professional, or adult social care professional. You work in an eligible health or social care job. So it's not just any job advertised, but the jobs that are actually qualified. And I always advise people to just go to NHS. If you're coming from abroad, if you're coming from other countries, just to be safe, go to a government jobs, go for government jobs like NHS. So just to increase your confidence, okay, so you know what you're doing. And then you have a certificate of sponsorship from your employer with information about the role that you have been offered in the UK. So when you get a job, it is actually the employer that will give you the certificate. You use that certificate to apply for this visa. Okay, and then you will be paid a minimum salary. How much depends on the type of work you do. So this is the eligibility, okay? So this is the kind of visa that they give to these people, to all these people that are qualified. So if you're qualified, so you just know that. So if you're qualified, you just know. You can also check if your job is eligible here. And they also require a knowledge of English. You must be able to speak, read, write, and understand English. Just stay with me. We are going to pick a case study and then we'll just go through it together so that after this video, you know exactly what you want to do. If you're qualified, then you go for it. If you are not qualified, then you know what to do in order to be qualified if you actually want to go for this visa. Okay, just stick with me to the end. So now you said you must have a knowledge of English, and that's that here. If you're not eligible for health and care worker visa, you may be eligible for another kind of visa, which is true. But now we are focusing on this health and care worker visa. They said this visa can last up to 5 years. I've already mentioned it in my last video, but in this video we just want to make it more concrete. Okay, so and then how you can apply, you have to apply outside of the UK before you come to the UK. Then if you're already in the UK and you have a visa, it's either you update it or you can just read about switching to a different visa. Okay, so that's that for the eligibility. Then some people that are like now worried, okay, where is the carer coming, like social care job, where is the carer job coming and all that? Okay, it actually comes under the adult social care professional or like some of these. So if you are now eligible, what you need to do is you just head over to myperfectcv.com, myperfectcv.com, to find a CV template that you can use to make your own very, very good. So when you have, there are so many places that you can get, but this myperfectcv.co.uk, actually, you can actually use it to find, to compile your own CV. So once you have a very good CV, a very good CV, the next thing you need to do is to look for jobs. This one is just taking a little bit of time to come. So now you can just compile your own CV, make it good, state where you have worked in the past, what you have been doing and everything, and then you'll be able to have a very good CV ready for your application. Then after that, then you can also, I've always mentioned that you can do it in two ways. You can use an agency, and you can also do it yourself. I'll talk about doing it yourself. For to do it yourself, just go to track.jobs. So when you go to track.jobs, then you open an account with them. They usually post all sorts of health related I'm not sure what is going on, but this is a good website to use. Track.jobs.nhs job vacancies. Okay. Another good one is this nhsjobs.com. It's the same track.jobs, yeah. So you can just go to that, open an account to track.jobs, so that you'll be able to track the jobs that you have already applied for. This nhsjobs.com is also very good. So when you apply, you can always go back to know what is going on. And as I described in the other video, what you can do is that you can click this one, you can click that one, and then you see all the, let's just click one. Okay. Okay, you can say healthcare assistant. So when you get all these healthcare assistant jobs, healthcare assistant, children and young people, healthcare assistant, urgent care, you see all of them are actually NHS. This band 2 is fine, but what I want you have to take note of when you're applying for jobs is that you go for jobs that the salary is 20,000 and above, like I mentioned in my previous video. Example is this one. So this explanation is for you to see what I'm talking about. So you go for the ones that are 20,000 and above, 20,000 and above. If you look for jobs in London, you are most likely to get the ones that are 20,000 and above, specifically because you may want to visa. Some people avoid London because they feel it's an expensive area to live in. But for the purpose of this visa, always know that the higher your salary, the more you are more qualified for this healthcare visa. So if you are going for healthcare assistant jobs, just know that you have to bear in mind the salary as well. And then when you see this kind of job and you click on one of them, let's look for the one that is 21,000. Let's say this one. So what you can do is you can contact the hospital and just tell them that you are an international applicant. Do they take international applicants, and are they willing to offer, and do they offer certificates of sponsorship? So if they do, they will let you know. If they don't, they will let you know. So you'll not waste your time thinking, oh, they are going to contact you. And even when they contact you, let it be that they are fully aware that you are an international applicant and you require a certificate of sponsorship. Okay, so now it's very good. It's always a good practice to always contact them, so you will be effective in your applications. You will not waste your time with those that said that they are not recruiting They are not offering certificate of sponsorship to international applicants. And the question I got from my previous video about senior carers being offered certificates of sponsorship, just to make that clear, if you go to the shortage of patient list, I think we'll find it here as well. Check if your job is eligible. Yeah, there is somewhere you can find the shortage. Yeah, okay. Check if your job is eligible. So if you go to this check if your job is eligible, you will see that the details of people that are actually qualified for this health and care worker visa. There's physical scientists, medical practitioners, pharmacists, dental practitioners, and then here you go, nurses, midwives, social care workers, dispensing of physicians, paramedics, nursing auxiliaries and assistants, dental nurses, and senior care workers. So they are all included in this health and care worker visa. So the thing is now finding that employer that is willing to give you a certificate of sponsorship. So if you're able to find them, and I've shown you that you go to track the jobs, and then you find these employers, contact them directly. This morning, I even contacted some of the agencies, asking them if they are actually recruiting international applicants. Some of them referred me to their recruitment team. So one thing I want to say is that don't be scared to any contact you see in the website. Don't be scared to ask them questions, to send them an email. If they are not the right person, if the wrong person receives your email, they will direct you to the right people to contact. So that's what happened this morning. I contacted the admin, and they said even though we don't accept international applicants in our courses, it may be helpful for you to speak with our recruitment team. And then I sent them an email, still waiting for the response. So one thing you have to do, like I know during my own time, it was really hard. When you go online, you find a lot of confusing. Sometimes you get all the steps and you're not able to do anything. But believe it, anything that anybody is telling you that is not in this particular website, this government website, please let this place be a reference for you. Where you guys, if they say anything that they say, let this place be a reference for you, so that as they are guiding you to apply, you are also in the know. You know exactly what you are doing. So if you're spending money on exams, you're spending money traveling here and there, you know that you have a very high chance of getting what you want. Okay, I hope this actually helps you. First of all, just as a recap, you go to this, you Google the health and care worker visa. You go to this particular place. There is an overview. The content is the overview. What the health and care worker visa is, the salary requirement that you need, who and who is actually included. For example, these ones, the dispensing officials, the senior co-workers, the salary requirement that, as I mentioned, you have 27 and above, 25 and above, and 20 and above. You can be paid 70% and 90% of the usual going rate. If your salary is 20,000 and above, then they said if your job is also in a shortage occupation list. Okay, just to make this demo as short as possible, I will end it now, and I'm going to start another recording just to go into the shortage occupation list and how you can take advantage of that if you are not in Healthline, or if you have family and friends that are not in Healthline, and what they actually can do. So I hope this demonstration was actually good. Another thing I want to say, okay, as I mentioned in the beginning, that I'll be giving an example. So assuming as an example, an auxiliary nurse in whatever country, I have my training that is up to 6 months and above, because I've seen an agency that is recruiting like that. So if I have a training that is 6 months and above, what I will do is I will come onto this website, just like I've shown you in the beginning. I will have a look. Okay, I am actually involved in this. So, and you have a CV, then you start applying, because the senior care workers, they don't require a regulation, because I've checked. First of all, if you require a regulation, some of these ones here, they require regulations, like the laboratory scientists, the biological scientists, and everything. before you can come to the UK, some of these ones, you have to also, just like the nurses, you have to also go through their regulatory bodies. Okay, just like in the UK, the regulatory body is called HCPC, Health HCPC. Okay, HCPC, this let's go there. So HCPC, HCPC UK. Okay, so it's Healthcare Professional Council. So even if you're qualified, you are included in that health sector, like nurses, you don't just start applying for job. You have to like get your documents, your documents verified by the nursing and midwifery council in your country and nursing and midwifery council in the UK. The same with other healthcare professionals like the radiographers, the pharmacy technicians, and everything. You have to like get yourself registered with them before you now start looking for job. But for senior carers, I did not see their name here, but we can have a look together. About us section of this Health and Care Professional Council. Say, who do we regulate? So these people, so they regulate professions and protected titles. They regulate arts, therapies, biomedical scientists, clinical sciences, dietitian, hearing aid dispensers, occupational therapists, operating department practitioners, physiographers, speech and language therapy. But you see, I did not see senior carers there. And I also saw you see, they are not there. I'm going to make another video explaining, assuming you are in the health and care, you are qualified for the health and care worker visa, but you are a dietitian or you're a paramedic or you're a physiotherapist. I will explain how this actually can go for you. But this particular explanation is for senior care. So you are not here, so you need to just look for a job, which is actually a good news for you. Okay. So I'm going to end this demonstration here. Just keep your questions coming. I'm not going to say anything that I don't know. And I'll try as much as possible to go to this website so that you are even aware. Because I remember my own time, sometimes I don't even know exactly where to go to find this information. And sometimes it's hard to get someone that has traveled to answer your questions. Then I know some nurses from Facebook. I'll send them messages. It takes days for them to respond. Sometimes they'll start responding, but then I cannot get hold of them. So I know how difficult this is, at least to have where to get this information. And I hope you find it helpful. If you still need more clarifications, I'll be happy. I've decided to just do some of these recordings just to help someone, even if it is one person, just to help someone. So thank you so much. If you find it helpful, please subscribe and like this video and share with someone that needs it. Okay, see you. Bye.